First of all, I would like to thank Dermatology Student Club for this invitation. In this half an hour, more or less, I will talk about Saudi Board of Dermatology. I will focus most precisely on my program in Western region. So let's start with historical background. The Saudi Board of Dermatology was established 24 years back in 1997 under supervision of Saudi Commission for Health Specialty. Dermatology is not only about Botox and filler, it's the field that studies skin, hair, nail, and mucous membrane, and to some extent, we also study sexual transmitted disease. In terms of subspecialty under dermatology, dermatology is the big umbrella. Under this umbrella, we have a wide variety of subspecialty like dermatopathology. If you specialize in dermatopathology, you can work on the lab. At the same time, you can practice the daily duties in the clinic. Also, we have peds dermatology. If you are a kind of person who love dealing with kids, you can specialize in peds dermatology. We have dermatosurgery. In this specialty, we have more surgery for BCC, hair transplant, a lot of excision. In some program, the laser and light is considered as under dermatosurgery. In addition, we have also nail disorder, hair disorder. We have dermatology and rheumatology, which are my favorite subspecialty, dealing with connective tissue diseases such as lupus, dermatomyositis. We have cosmetic dermatology, the new era in dermatology at this time. We have also the cutaneous oncology. We have contact dermatitis and patch testing. You need to have a good memory to specialize in this specialty. There is a lot of memorization in this subspecialty. We also have advanced medical dermatology, immunobolus diseases, and finally the epidemiology and research. Okay, that's all in term of subspecialty. Let's dive in on the structure and teaching way in their program. Regarding the program, it is a 4-year structured training in dermatology and related subspecialty. It's a joint program with a mandatory rotation between all 5 hospitals. We have 2 hospitals in Mecca, King Abdulaziz Hospital and Hira Hospital, and 3 hospitals in Jeddah. We have National Guard Hospital, King Fahd Armed Force Hospital, and King Fahd General Hospital. Regarding the seats, each year usually 10 nominated, in average 6 to 8 accepted. The number of seats varies each year. Regarding the cumulative percentage also varies each year. According to the Saudi Commission for Health Specialty website, it was 82.42 in last year. So look out for the updated ones. In terms of seat in other region of Saudi, as far as I know, and according to Saudi Commission, in central region there is 18 seats, 17 seat for Riyadh, and only 1 seat for Al Qasim. In Eastern region, it's similar to Western region. There is only six seat. It is a joint program as well between Al Qatif and Dammam. Regarding the southern regions, there is 3 seat only. Okay, let's gonna move to the curriculum in detail. So in the first year of residency, it is a rotational based. The main bulk will be for internal medicine. It's about 5 months. You will rotate between the subspecialty of internal medicine. You will do endocrinology, hematology, rheumatology, infectious disease, and etc. You have 1 month in emergency medicine, 3 months in peds, and 2 month electives. That's all for the first year of residency. In regard to the exam, no promotion exam in the first year. Part 1 is an optional. It's not a mandatory, it's free, and you are free in first year. In second year of residency, you will start your real job as a dermatologist, covering dermatology outpatient clinic. Usually the clinic service start from 8 a.m. until 4 p.m. The workload will vary depending on the hospital. Also, you should cover the on-call as a home call based or the in-service consultation. In terms of exam, in second year, we have 2 exams. Promotion exam, which is 2 parts, clinical and written, and we have part 1 exam. Part 1 now is mandatory to move to the senior level. In third year of residency, just like the second year, along with 2 month elective, depend on your interest. You can do dermatosurgery, laser, dermatopathology, research, whatever you want. In terms of exam in the third year of residency, you have only one exam, the promotion exam, to be promoted to the fourth year, the final year. In the fourth year of residency, almost the same. The only difference that you can take 3 electives. And regarding the exam, we have the final exam, the part 2 exam. That's all about the curriculum, the residency years. Moving to the on-call and vacation. In regard to the on-call, on average, it is 1 week per month as a consultation service and home on-call from 4 p.m. till next day. As a senior resident, R2 and R3, you will cover as a first on-call. As a senior, you should cover as a second on-call. Regarding the vacation, we have 4 weeks vacation as annual leave, 1 week vacation as educational, and 1 week of either right vacation. Okay. In terms of training and teaching, we have two types of training. Either training during the clinic, during practicing the clinic, or during the bedside teaching, or the teaching activity, which occur every Tuesday. It is a full day teaching. In this teaching, we will discuss the basic science, therapeutic. Sometimes there is grand round, book review, lectures. We have also dermatopathology session on Tuesday in the same days of teaching. Regarding the research, it is mandatory to have published research before fourth year of residency. Okay. By the end of the program, you should be expert on basic science of the skin, pharmacology and therapeutic, clinical diagnostic skill, dermatological procedure, dermatopathology, dermatological surgery, phototherapy and laser, finally the research. Okay, let's move to the pros and cons. My opinion, the positive aspect about being a dermatologist is that it's a unique subspecialty. We have both surgical and medical aspect in dermatology, dealing with a stable patient with different age group and both gender. Rarely you might have life-threatening or truly sick patient. If you have a bad leg, you can face Steven Johnson or other. This dermatology, as we all know, it's highly competitive specialty with a limited seat, but nothing impossible. You can't do it. Dermatology, it's about reading. You should read all the time. Keep yourself updated. At the end, this is my tip for you to increase your chance of getting acceptance. If you are a medical student in fourth or fifth year, take an summer elective. It's a good chance student in fourth or fifth years, try to take a summer elective. It's a good chance to decide and to show yourself. During the internship, take elective and be active. Try to do procedure, writing note. Try to be involved in the clinic. Try to attend conferences like Saudi Derm, Jeddah Derm, Dubai Derm, Sharm Derm. There is Medam also. Do a case report and researches, do poster presentation, take recommendation letter, prepare yourself early, work on your CV, fulfill all the requirement required by Saudi Commission for Health Specialty, prepare yourself for interview. Regarding the interview in Western program, it is only one interview done for all hospital at the same time, followed by sponsorship interview offered by some hospital like National Guard and King Fahd Armed Force Hospital. Don't forget to look out for the updated dates in the website of Saudi Commission for Health Specialty. That's the end of my talk. I would like to thank all the program director to their effort and support. Thanks for joining us today. Feel free to contact me for any further information.
Thank you, Dr. Ibtihal. It was very informative session. We just have a question.
Okay.
Which hospitals in Jeddah allows medical students to take dermatology electives?
Okay. Regarding the electives, try to take the elective in hospitals that have dermatology programs. So in Jeddah, we have three hospitals: King Fahd Armed Force Hospital, King Fahd General Hospital, and National Guard.
Okay, thank you so much, Dr. Ibtihal, and thank you everyone for attending. And we'll see you, inshallah, in our next activities.
If there's any questions or